Earwax, or cerumen, can be impacted in the ear canal and sometimes must be removed. Impacted cerumen can be removed using irrigation, manual extraction, or both. Irrigation, which is less painful, is often tried first. Before irrigation, insert a few drops of something to dissolve cerumen, termed a cerumenolytic, in the canal. Effective cerumenolytics include a 5 to 10% solution of sodium bicarbonate, about 3% hydrogen peroxide, which is used in this video, the stool softener docusate sodium, and possibly triethanolamine or olive oil. Attach a plastic catheter to a syringe before or after drawing up the cerumenolytic solution. Draw the solution into the syringe. Lay the patient on her side and brush the hair aside to expose the ear canal. Place a few drops into the canal. Hydrogen peroxide solution begins to foam within a few seconds after contacting cerumen. Leave the cerumenolytic solution in the canal for 15 to 30 minutes. Draw up body temperature water into a 30 or 60 milliliter syringe and attach an 18 to 20 gauge plastic catheter. Have the patient sit erect and put a sheet or towel over the shoulder and place a basin snugly against the neck just under the earlobe. Retract the pinna and irrigate using moderate pressure, aiming slightly superiorly and without inserting the catheter inside the canal itself. Cerumen removed by the irrigation will appear in the basin. After irrigation, check the canal for residual impacted cerumen. Repeat irrigation as needed. Remove cerumen manually if irrigation fails. If the cerumen seems soft, first try a cotton-tipped applicator. That can sometimes remove soft cerumen gently and with little pain. However, a firmer instrument, for example a plastic curette, is often necessary for manual removal of hard cerumen impactions such as this one. Use the curved edge to pin cerumen against the canal, then withdraw the curette, removing the cerumen. Avoid damaging the fragile skin in the canal when using any firm instrument. If removal was traumatic or unusually vigorous, some clinicians insert a drop of ciprofloxacin corticosteroid suspension after the procedure. In immunocompromised or high-risk patients, including diabetics, some clinicians use only sterile water or saline to irrigate the canal and follow irrigation by inserting 2% acetic acid or a fluoroquinolone eardrop.